Welcome back to the Nutrimedical Report. We have Ryan Frace here. Ryan, we're talking about some new protocols, and one of the ones I mentioned just before the break was how to build muscles. And I had one young guy contact me the other day. He was real pleased with our Mega Muscles and our Sports Energy Light. The Mega Muscles, I tell people, take a half a teaspoon or a scoop in water before exercise and before sleep. And of course, we have microdose, which is the 100 nanograms of actual growth hormone in the morning, bedtimes, and before exercise. Supernox to release growth hormone. Collagen Max, of course, to build a superstructure for building new muscles, and Mountain Red Velvet. And if you're worried about joints, tendon bend, or joint performance, to rebuild your connective tissues is really important. So that gives you the whole kind of range of things. And the Pro Collagen you can use with Her Majesty's Royal Jelly before you take Collagen Max. So Mega Muscles, let's talk about that for a minute, because a lot of people don't realize that literally I've crafted hundreds of wellness protocols for virtually any health condition, whether it's vertigo, building muscle, losing weight with our things like Lipo Flush, and Green Tea Select, a very powerful combination to the conjugated linoleic acid is incredibly powerful to mobilize what I call the angry fat around your middle. If you're, we call it this pear shape, like diabetes or syndrome X or prediabetes. Lipo Flush is one of the most important things to prevent fatty liver, along with neovascular, vitamin B3 activated form, and Lipo Flush. So let's talk about Mega Muscles for a minute and some of these other things.
Yeah, Mega Muscles is really a breakthrough in research that's been happening for almost 2 decades, and it started out in research that was done in pediatric burn units, and the whole point was to try to help the body to build tissue, in particular muscle, at a better and higher rate. And it has to do with a very particular ratio of these specific amino acids that kind of is a key that unlocks the body's ability to want to build more muscle and build it faster. And so individuals that are looking to put on more muscle mass, obviously that's important, because if you get your muscle ratio to fat ratio shifting in the right direction, you burn more calories. Obviously, you look better, your clothes fit better. That's an exciting thing. And then for people that do any kind of athletics, obviously having more muscle mass is a really great thing for people. And if you're hitting the gym and you want to see better results, again, having this amino acids is really an important thing. Studies have been done where they show after you go and work out, and it could be aerobic or it could be using weights. For some people, and this is more people than less, is they end up in this amino acid deficit. And so what they're doing is they're having to they're in a hole, if you will. And if you go and just eat random protein, just drink down a random protein shake, if you don't have this particular ratio, you don't put yourself back into this positive balance where you can build muscle. And so unfortunately, some people can be working out and trying to do things that are helpful, but without the support of something like Mega Muscles, they may be kind of spinning their wheels or in some ways slipping backwards because they're tearing down without the possibilities of building back up. And so this is a really neat thing for people to think about. And, of course, if anybody is in a bedridden state, broke a limb, wheelchair, bed rest, very dangerous in the sense that you start losing muscle mass very quickly just in a matter of a few days. And that becomes very much a health condition. You want to make sure that you're supplementing with something like Mega Muscles to ensure that you're maintaining your muscle mass.
Yeah, it's really quite important, isn't it?
Yeah. It's probably your number one biomarker of aging. If you want to know how long you're going to live, generally speaking, for the most people, it's going to be that muscle mass. As that muscle mass goes, what we know is not only is your mobility possibly compromised, but for sure your immune system. And so oftentimes you hear about people, right? They hit that hospital bed and they broke a hip or something like that, but they don't die from that. They die from pneumonia. It's because they've lost their muscle mass. They can't mount an immune defense. And so it's a critical issue for people.
Yeah, quite amazing how a lot of people don't realize just how important these different factors are. One of the things that I often find is that there are people that are non-health professionals, and I'm talking about even health professionals that are not trained in functional medicine, infectious disease, toxicology, intermediate metabolism, etc. And let's say in America there's, say, 680,000 health professionals. There's probably less than 1,000 trained in functional medicine, a couple thousand doing a little bit of anti-aging on the side. And there are probably just a few hundred actually trained to the level that I am in terms of experience and training. in terms of knowing what to do. The average doctor is very hampered, but people that are non-health professionals, when they give out nutritional and functional medicine advice, they're out of their depth. They really shouldn't be opening their mouth at all. It's extremely complicated and simple at the same time. But if you don't understand the physiology, toxicology, intermediate metabolism, and genetics, and you're flogging out different nutraceutical supplements and saying, take this, it'll cure you, it's ridiculous. And I honestly don't think there's, quote, a silver bullet. The closest we have is probably Nutrimedical and things like Allicin for knocking out pathogens. But you often have a combination of things, and you have to do testing, too, to see if where you're on track. For example, I had a recent request by a person who wanted to know what to take for optimizing their immune system. I said, well, start off with knocking off the pathogens like Allicin or Nutrimedical, Silver 100. Take immune stimulants like NutriDefense, immunoglobulins like NutriImmune, which is immunoglobulins, and boost your mineral content, because your immune system is dependent on things like zinc and copper and all the other trace elements like selenium. And if you don't have those minerals, your immune system can't function. You can't protect yourself from free radicals. If you're getting a lot of free radical elevation or inflammatory markers like high sensitivity C-reactive protein for your heart, or better markers called Pi1, which if you ask the average cardiologist, they don't have the faintest idea because they don't do research. I do research, okay, and I work with people like Dr. Ralph Holsworth for years, where we would have him on the program talking about his work with Dr. Sumi in Japan on nattokinase, which, by the way, we also have lumbrokinase. When people say, well, my relatives all died of a stroke, I said, well, you need to get a rheologic test for your blood viscosity, non-Newtonian fluid dynamics, and you need to measure these other markers, including C-reactive protein, Pi1, and fibrin degradation products, etc. You also need to look at the genetics of hypercoagulation disorders such as factor V Leiden mutation and other factors like elevated platelet count, etc. And the average doctors don't know how to do this. They actually don't know how to do the actual advanced functional testing, even cardiologists and vascular disease specialists, and which I find really disturbing, because when I consult with doctors and patients around the world, there's no shortage of stupidity. And there's no nice way to put it around it. There isn't. The problem is you actually have to test or you don't know. It's like a carpenter, measure twice, cut once. You probably should measure 3 times before you cut with a nutraceutical and or a drug. And drugs, by and large, are pretty damn dangerous. If you use a rare combination, depending on not knowing the patient's genetics, you can kill them or make them very sick. And, of course, older people can't detoxify drugs, so they get in a lot of trouble really, really, really fast. So, Ryan, when we talk about the immune system function, what would you think are the top ones you think? I think of Malignablock, Elagic acid, NutriImmune, for cancer, you want things like that.
Yeah, I think that a lot of people should be looking at formulations, like you're saying here, the NutriImmune, the Immunomax. I think there's a lot of people that need to just start with fundamentals like Living Probiotic or Living Probiotic Ultra to make sure that that gut, which is where a lot of this dysfunction starts occurring in the original aspect, 2/3 of your immune cells in the intestinal tract, and a lot of people, due to sugar, alcohol, stress, just poor decision-making and diet, end up causing an imbalance in that bacteria. And using something like Living Probiotic as kind of a base everyday formula, or using Living Probiotic Ultra as a way to storm in there, make sure that you can kind of change the balance very quickly from bad to good bacteria counts. And then from there, something like Immunomax to help really support the neutralization of viral, bacterial, environmental, and food sensitivities.
Yeah, exactly. And a lot of people think, well, you can't measure that. Yes, you can, actually. We have imaging studies, we've got genetic tests, we've got organic acids, we've got metabolites, and I'm a master of all of them. And when I don't know, I know where to go to get experts that know more than me on a particular area. And like, as I say, I like one of my favorite shows to watch is Star Trek. I have the capacity to do Vulcan mind meld to my colleagues, and they're close to photographic memory, so I pull in their information and integrate it without cognitive dissonance, so I can tell you what you need to do and train the doctors so that no matter what specialty they are, if they're a surgeon or whatever, or a transplant specialist, I can make a better doctor of them in 1/2 hour. And I challenge anybody out there, if you have a health issue, call or email, I'll help you with a consult. Yeah. And welcome back, and Ryan, so we're talking about boosting people's immune system and trying to kind of get them back on track. By the way, we do have just for a little notice here, we do carry some of our 6-pack specials of things that we've taken off a regular line, like Ageless Energize. We still carry those and ship them out. And Calm Mind Flavorless, those are still available. You know, we're always expanding our technologies. Usually we do big announcements coming up in October when we have some new nutraceuticals that are coming online. We are renaming the Allergon to going to be called histamine cytokinase, very important for autoimmune disease, for reducing cytokines that cause heart disease, dementia, etc. It doesn't just work in the gut. It works because there's a lot of foods that have histamine, but it works throughout the body and even the brain. For example, histamine crashes on your blood-brain barrier. It messes up your brain. So if you see a child with ADD, it's not just food allergy, it's histamine released from the gut that actually, or the foods that actually will cause a change in behavior. Interesting, hey?
I love that. Love that story, that people can sort of think about it differently when it comes to, not just anxiety, I should say, but activity disorders, hyperactivity, that there's underlying issues there where that can be handled. The histamine issue can be overwhelming somebody, and that's now using something like the histamine cytokinase formulation allows you to go in and help work on these histamine loads that a lot of people are triggering, and they're expressing it not as people would normally expect, which when I say high histamine, most people will instantaneously knee-jerk reaction is to say runny nose, difficulty with the environment, seasonal allergies, when in fact there's such a deeper issue that most people are unaware of that could be anywhere from vertigo to arrhythmias to hyperactivity disorders to hormone imbalance to immune system compromising to skin issues to GI issues. People don't make that connection. They don't make the connection that an H2 blocker, Dr. Bill, it's one of the more common things to be prescribed for people because there's so much digestive dysfunction. And they don't even know what an H2 blocker is. All they know is they overproduce acid. And so they take what's known as an H2 blocker. But if you ask them, well, if you produce too much acid, why are you blocking what's called H2? And they have no idea. And you go, well, what is H? That's histamine. So you really don't have too much acid. You have too much histamine. Or your histamine is expressing itself, if you will, too much down that pathway. It's a very interesting thing when people start recognizing, well, that's happening a lot in a lot of different ways around our bodies. And if we can make sure that we can have the enzyme, just like we have enzymes to break down fat, just like we have the enzymes to break down proteins and sugars and so forth, that you have enough of diamine oxidase, the enzyme that regulates histamine. That's a critical element. And that's a story that most people are very, very unfamiliar with.
I had a recent consultation from a diabetic, and they were exposed to Arthrotec, which contains an anti-inflammatory and a secondary drug. And what it did is it put the person into renal failure. Of course, you got to know as a diabetic, taking non-steroidals, especially Arthrotec, is a terminal thing to do. The number of people that end up on renal failure due to Tylenol, non-steroidal anti-inflammatories, and a number of drugs that their doctors give them, such as overtreating their blood pressure so they decrease renal perfusion, is horrendous. All I'd need to do is, if I get tired of doing radio, is pick up a law degree, and I could literally, like in a shooting gallery at the Midway, pick off doctors easy. It would be like, like going out with a duck shoot with a star scope on it and a sniper rifle. It would be ridiculous. So out there, doctors, if you think it's a real smart thing to give all your diabetic patients these things, you're an idiot and you're going to get sued. Okay? And so if you're a patient and you've been exposed to this, the first thing I tell people, take ultrathymine B1, take carnosine, take vein away. And let's talk about vein away for a minute, because this protects the kidney and the glomeruli from damage. And also you want to stop cross-linking of proteins. So you want to take Nutritrala, cell detox glutathione, and to regenerate the kidney, Nutrifos, Neurogen, Minerals Plus, and Copper Regenamax. So those will all work as a formula to try to help the kidney, but the first one I recommend is ultrathymine B1 and vein away. Let's explain these as to why they'll protect the kidney of a diabetic and a person previously exposed to overtreatment by their dumb doctors.
Well, the ultrathymine B1 is fascinating, and people shouldn't get it confused with regular B1 that they find like in multivitamins and stuff like that. It's different. Even in a B complex, you're typically not going to see this one. You've got to have a unique, company like your the Nutrimedical line in order to deliver this. But the ultra-thiamine B1 is a fat-soluble form of B1. One of its most powerful effects is the inhibition of the creation of what are known advanced glycosylated end products, AGEs.
Right.
And the best way to think about AGEs is think about rust on a car, the browning of an apple, the burning of the top of creme brulee and getting crusty. Well, those reactions, similar things happening in our cells, in particular areas that are very fragile, like the kidneys, like you were saying, and doing damage. Well, if you can interrupt that process from continuing to happen, by making sure that you don't have a deficiency in this, the ultra-thiamine B1, which is the fat-soluble form of B1, that's huge. And then from there, another way to protect tissues that is a very powerful antioxidant that works in vast ranges of our vascular system is the formulation Vein Away. And the ingredient that's in there is a patented compound that's been studied for 50 years known as diosomine. And diosomine comes from it's actually that white part of the orange that you'd like probably peel away and throw away. Well, that gets purified down and you end up with a very powerful substance that's been studied all along the spectrum of what's known as CVI, or chronic venous insufficiencies, that can range from spider veins onto varicose veins to hemorrhoids to cardiovascular challenges. But one of the interesting things was albumin filtration rates, so kidney function for diabetics, and it was very profound in helping to normalize these filtration rates because it was so protective to the kidney and the tissue and helping the circulation again. So very, very profound formulations, and those two in combination would be great. I think glycemic meal usually are going to be a good thing. Also, people with kidney challenges, Dr. Bill, what's a good connection to make is the mega muscles. Sounds like a giant leap, right? But what's interesting about mega muscles is that amino acid blend has been compared to using straight like whey protein for muscle synthesis. What they find is you have to use like twice as much of the whey protein. If you just use this mega muscles, what you're doing is you're able to synthesize and utilize amino acids to build muscle, meaning if people already have kidney troubles, they're not looking to consume a lot more protein. That's usually a big stressor on people and people with gout. Yeah. And so it's interesting to think about the mega muscles could help people to better utilize the smaller amounts of protein they need to take. And a lot of people spend too much money eating protein. They're just, they're wasting their money by trying to consume large amounts of protein every day, when in fact, if you can get your body to better utilize the amino acids by using something like mega muscles, you're not going to need to consume or pay for as much
Exactly.
protein.
The drink I have on my desk right now is a combination of Brain Mag, Sports Energy Light, D-ribose, acetyl L-carnitine, and Mega Muscles powder. And it's amazing. The flavor is fantastic. It empowers me through the day. It's got chlorogenic acid, it has all the electrolytes, the antioxidant protection, the Brain Mag to protect the central nervous system, the things to boost energy metabolism in the mitochondria, the LC1000, D-ribose, etc. It's phenomenal. So I tell people, Mega Muscles has a lot of applications. We'll be back in a moment with Ryan. And by the way, every hour of the program is open lines. If you have a question that has to stay on topic, they're all screened. You have to tell the board op. Today it's Ben. He's filling in for Aaron. And Shane is tomorrow. And then Wednesday through Friday is John. So you want to tell the board op exactly what your statement or question is. It has to stay on topic or you don't get on air. And there's a whole bunch of rules, but I screen every call coming through. It's not unscreened. So you can call 800-259-5791, and you can have either your question read, or you can come on air yourself anywhere in the world, and you can call our 800 number, 800-259-5791. Only hour that's not open lines is first hour Friday, where we are answering your questions, so it's pointless to have open lines when we already have Michelle with probably 2 hours of questions that we're trying to answer in 1 hour. So that's the only hour that's not open lines. So Ryan, one of the big issues we see is a lot of people that are trying to get fit. And like Mega Muscles is a good intro. We have, of course, Microdose. Somebody just emailed me that wanted to know more information about Microdose. Microdose is our growth hormone. It actually is a homeopathic. It's 100 nanograms per spray. We recommend 5 sprays morning, bedtime, and before exercise. And it works perfect with the mega muscles. I also recommend that they take the Sports Energy Light to get the electrolytes in there. And they need all the trace elements to rebuild muscle, which means they're going to need to have Collagen Max, tendon bender, and joint performance, because when you're building muscles, you also have to make sure the tensile strength of your connective tissues and your joints are able to handle the loading force of the activity of those new mega muscles you're building. So let's talk about tendon bender and joint performance for a minute, and how they fit in with our Collagen Max and Mountain Red Velvet to rebuild a better you. In other words, let's rebuild a better you, but you better have the components to do so, or you're not going to do a good job. And like Gronkowski, the Patriots there, the monster, football player, he tore his ACL because his muscles were so big and he wasn't having good proprioceptive control. He had micro injuries and eventually ruptured his ACL. So if you don't want that to happen to you, and of course you don't want to blow at this with doing stupid things like CrossFit, do VibraFit, which is a vibrational platform, body elastic bands, and free like Bowflex adjustable weights and resistance, so you have less chance of injury. But what's in tendon bender and joint performance? Whether it's preventing discs to be blown out, to preventing carpal tunnel syndrome and shoulder capsulitis, where the rotator cuff's inflamed, plantar fasciitis. These are really good formulas, especially along with anti-inflammatories like Inflamex and cell defense.
Yeah. The tendon bender has really been a fascinating formulation because it goes in and it really is kind of like a reprogramming, almost like a computer program that goes in to fix a bug. And the way that happens is people get repetitive motion injuries and they get a thickening of the tendons and these tenocyte cells. And what happens is they basically restrict motion and they create inflammation. And as anybody that's had these problems, occur, they're very difficult to get rid of, and rehab can be very challenging. So a lot of times you end up with braces or something strapped around a knee or an elbow or something like that to limit mobility so that you just don't deal with the pain. And this can be months, in some cases years, for people to recover. And tendon bender is so fascinating because the cutting-edge technology of a resource that when you put it in, it tells the tenocytes that they can realign, kind of relaxed, and what they've seen in ultrasound and so forth is that these things realign and thin out, and that creates a change in the pain and inflammation, and mobility and range of motion can be restored. And so it's been very, very successful in the Nutrimedical line.
Yeah, the other one that kind of works with it indirectly, and this is an interesting discovery, is leptin metabolic. And it has a metabolic activity in terms of adjusting your appetite, your insulin resistance, your leptin resistance, your fatty acid metabolism, but also the cytokine level in your joints. So I tell people if you're taking things like Inflamex, tendon bender, leptin metabolic is going to reduce the osteoarthritic inflammation of your joint capsules, your rotator cuffs, the tenocytes around the tendon sheaths, if you want to call it. Tenosynovitis is a fancy medical term. So you can actually reverse tenosynovitis with these 3 things: Inflamex, tendon bender, and leptin metabolic. So let's talk about leptin metabolic for a minute, because a lot of people don't realize what is the molecular structure of leptin metabolic and why does it have this interesting kind of down-regulating effect on cytokines in the joints as well as the insulin and leptin receptor.
Yeah, the leptin metabolic formulation is very unique when it's taken in. Basically, it's helping to resensitize the body to the message of leptin, which is a signaling coming from the fat cells to the brain. And one of the key elements is appetite regulation. And so I know there's a lot of people out there that are probably frustrated with diets and trying to do their best with self-control. And it's very interesting to know that just like there's insulin resistance, there's also leptin resistance. And but in this case, it's going to have a lot to do with your craving and needing to eat. And so it's fascinating when people use leptin metabolic is that most common thing is going to be about appetite. I just don't feel like I need to eat as much. This isn't an appetite suppressant. This is literally just helping your body to recognize the signal that's already floating around and trying to land in the right spot in your brain to say, hey, look, we have a lot of stored calories in our body. There's no need to keep consuming more and more calories. We don't need them. And I think there's probably 9 out of 10 people out there right now going, I would love to have that message in my body. Well, if there is this leptin insensitivity, this could be part of the challenge that you're facing. And so that's where this comes into play. Now, the other side of it is shown that in studies that they can bring down inflammatory markers just across the board, whether it be in the synovial fluid, where you'd see like with osteoarthritis of the knee, or inflammation that's in the blood, just circulating. And by using the leptin metabolic, it is not only just this leptin sensitivity, it's actually working at bringing down a lot of these inflammatory markers. And it's kind of a chicken and an egg format. Is the leptin issue, kind of triggering that, or is the inflammation then helping with leptin sensitivity, sort of a thing?
Exactly. It's kind of amazing how these nutraceuticals have actions across a whole range of different health conditions that you wouldn't necessarily connect. One of the ones that's very important is Supernox, and I've been doing a lot of research recently, and we're always working on trying to upgrade formulas as well, but Supernox is very important. And I read something recently in Dr. Blaylock's newsletter, and it was actually incorrect, that nitric oxide is bad for you. And actually, you have to understand this. There's good nitric oxide and there's bad. Nitroperoxy radical is one of the real bad ones. And our formula, Supernox, is specifically designed to stimulate the nitric oxide that relaxes blood vessels, stimulates erections, stimulates release of growth hormone in your brain, is good, not the bad. And you need to have a high nitrate diet. I recommend people get beet juice or beet juice powder, like Hill Farms beet juice powder from Amazon or at the health food store. But Supernox is very important for hypertension control, for sexual function in males, and for release of hormones in the brain like growth hormone. So let's talk about Supernox for a minute. This is extremely important. It's part of our cardiovascular protocol. And how does it work? What makes it unique compared to other, we call nitric oxide producers that in error? Again, this is a real significant problem. And I read this newsletter this weekend from Dr. Blaylock. He said, it's bad. I'm saying, no, you have to discern whether it's nitroperoxy radical, which you can actually measure as a DNA adducts, the nitroperoxy radical, or physiological nitric oxide, because you can actually do Berkeley test strips in the back of your tongue. And if you don't have adequate nitric oxide, in syndrome X, which is diabetes, pre-diabetes, which is syndrome X, or cardiovascular problems, low nitric oxide is real bad.
Yeah. Nobel Prize winning research on that, right? One of the lead guys, Louis Ignarro, wrote a book, No More Heart Disease, talking about the fact that if nitric oxide does drop, then the heart disease progression ensues. And so people can get confused if, like you're saying there, there's forms of it that can be very damaging. What we're talking about with using something like Supernox is enhancing the good nitric oxide effect in the body, but doing it in a safe manner.
Yeah, it's called INOS, which is inducible nitric oxide, that regulates capillary relaxation, peristaltic contraction of your blood vessel, arterioles and venules that actually move the blood around your body. If you look at the cross-sectional area and the non-Newtonian fluid dynamic equations, which I have, if somebody wants to challenge me, I got all these fancy non-linear equations and using special types of calculus, etc., that show that your blood vessels, not your heart, pumps the blood around your body. And without nitric oxide, it doesn't work. And hypertension is just the heart compensating for poor circulation. Amazing, hey? So doctors out there, you think you know this? You got Deagle challenging you. You don't know what you're talking about. Okay, I'll be back in just a minute. Ask. Have someone to call me. I'd like to work. So welcome back, and next thing I'd like to talk about is methylation. And a lot of people misunderstand the power and amazingness of Samethyl. We use BioLVR and Samethyl for reversing depression. We use Samethyl along with our methylation pathway support, superfolate, pyromethyl B12, and BioLVR for removing heavy metals. And for methylation, one of the major pathways for removing chemicals in the body, there's three major phase 2 detox pathways: methylation, sulfation, and glucuronidation, etc., in the cytochrome systems in your liver. And methylation is necessary for making digestive enzymes, myelinating nerve fiber tracts in your brain, centrally and peripherally, doing multiple things in your body. Without methylation, you can't get rid of homocysteine, which is a very nasty byproduct that can actually damage your brain and your blood vessel walls. So taking Samethyl BioLVR, superfolate, and power muscle B12 can reverse it. And when I asked people if they had a homocysteine level, I asked them, did they do an L-methionine challenge beforehand, which means you gave them a challenge of methyl groups from L-methionine. And they said, no, my doctor never did that. And I'm talking about functional medicine docs. I said, well, you missed 2/3 or more, up to 3/4 of the people that could have significantly dangerously high homocysteine levels if you don't do a 500 milligram L-methionine challenge the night before you do the blood test. So if you're out there and you're asking your doctor, including a functional medicine doc, you have to do an L-methionine challenge first. The amount of people with methyl group deficiency disorders, whether it's low levels of activated folic acid to prevent neural tube defects in their children, brain activation through pyrrolase and tryptase enzymes for actually creating neurotransmitters from amino acids, myelinations of nerve fiber tracts in the brain if somebody's getting early, what we call pre-dementia. We do a special, what's called T1 weighted MRI scan, look for myelination patterns, which you can actually preset the MRI scan. You'll see that people that are getting dementia, they're basically getting frayed wiring in their brain. Their myelination's going to hell. It's not just people with multiple sclerosis. You can get what's called patchy dysmyelination for non-MS disorders, where you actually start to lose the wiring sheathing around your nerve fiber tracts for saltatory nerve conduction between different areas of what's called intercortical transport of neural networks. So you can actually test and see these also on a quantitative electroencephalogram or positron emission tomogram of the brain, or SPECT blood flow scan, because you see abnormal blood flow as well. So Ryan, let's talk about this for a minute. Methylation is a really big deal. I have to keep pounding at this because a lot of people don't realize how important methylation is for your heart health, your brain health, your digestive enzyme health, your detoxification health, and reversing things like peripheral neuropathy or central neuropathy like vertigo syndromes or optic neuritis or any of these other conditions where you're trying to reverse dysmyelination. So let's talk about methylation for a minute.
Well, if you don't methylate well, your cells are dysfunctional. It's like your engine's misfiring, and so want to make sure that they're firing on all cylinders. This is what you're saying is make sure that you've got the nutrients. And I want to backtrack just a second to a foundational thing that everybody needs to be doing, which is something like Vitamin Max.
Right, exactly. And Minerals Plus. Both of them, yeah. Vitamin Max and Minerals Plus. These are foundational. Go ahead.
Well, without those foundation, a lot of times people are picking multivitamins and minerals from other sources, retail brands or wherever they may be getting them, and they don't have the activated forms of the B vitamins, and so they're already putting themselves kind of, behind the eight ball. They don't have the 4th generation folic acid that you find in this formulation that is 10% greater bioavailability than any of the other forms of L5-methyl tetrahydrofolate on the market. And they don't use the albion chelate. So what I'm saying is that they don't even have the very basics they need each and every day. And then from there, starting to move into the methylation formula support and so forth for people that, as you talk about, the elevations in homocysteine is usually a good way to start looking at that and saying, hey, look, the cells are misfiring. We need greater support, and then adding in that support.
Yeah, if you see, for example, somebody has a family history of stroke, the very first thing is to look at, do they have high levels of high-sensitivity C-reactive protein or PI1? Do they have elevated fibrin degradation products? But something that's often missed by their doctors and cardiologists and neurologists is homocysteine. Homocysteine is a real devil, and it's a sneaky devil. Dr. Kilmer-McCulley did research on it with looking at maple syrup urine disease in children where they get cardiac disease and strokes at 10 and 11, 12, males especially. And he proposed back 40 years ago when he was doing his fellowship at Harvard University, and he was, of course, a very brilliant cardiology student and biochemist, that homocysteine was particularly a nasty independent cardiac risk factor, but it's also a risk factor for dementia. So if you have this and you want to have a stroke or whatever, your homocysteine is a major factor that can induce raggedness and damage to your intimal lining of your artery walls and will cause you to have a stroke really quickly. So it's not a minor thing, taking some methyl. You take a sachet under your tongue, If you don't believe that your blood viscosity is high, you can do a rheologic blood test. You can actually measure metabolites and measure, for example, all the metabolites. In fact, if you don't have actual methylation, you can't create tetrahydrobiopterin and maintain adequate levels of nitric oxide. So Cimethyl works directly with Supernox to maintain your vascular and your brain levels of the healthy nitric oxide. It's really important, isn't it?
Absolutely.
Yeah. So, and of course, it works with power-methyl B12, superfolate, and bio-LVR. And I tell people, do not neglect this. This is a really big factor. And Macaulay years later got, positively rewarded, but after 30 years of persecution and demotion for his boldness to say that the homocysteine was a problem and his colleagues didn't want to accept it, it's typical that your colleagues, being knuckleheads, will actually persecute someone who's a decades ahead of their colleagues, like Dr. Macaulay, and later on give him approbations when he's in his 50s after 25 or 30 years of cardiology. It's aggravating. Yeah. So that's a good example of what I call how doctors eat their own young. Let's put it that way. They have a cult kind of attitude toward colleagues that step out of line. Well, listen up, docs. You don't have the storehouse of all knowledge. In fact, if I train medical students, residents, or people who call me worldwide, I train them step out of line, make sure you have good science, good analysis and logic, and run with it. Like the book Habakkuk, chapter 2. Let he who reads this on tables of stone or listens to the Nutrimedical report run with it. Don't think that your doctor colleagues or even I have the storehouse of all knowledge. Challenge everything with science and logic. Everything. One of my other favorites is Nutri-Complete, and we put it back up. It's the most complete veggies and fruit goji berry juice. People say, well, I want something really, really complete. I say, well, make a smoothie up with ageless life support and Nutri-Complete. What's in it that makes it so super and so great tasting, etc., and why is it so important for people? I put it in our drinks all the time when I make up my drink for myself and my daughter, Kelsey. Nutri-Complete. What's in it?
Well, Nutri-Complete is a combination of reds and greens, so this is fruit and vegetables, and I know a lot of people don't get, a good, adequate amount of fruits and vegetables every single day, particularly organic forms, and then forms that also have that long-lasting antioxidant effect, or what we call indirect antioxidant effect. And those are also represented in this formulation, and it's so easy to use. Just a small scoop added to whatever shake you want, or just drink it directly in juice or just in straight water. It's a berry flavor overall, and it's a wonderful way to enhance. And people starting up, they comment about how their brain is working or how their energy feels when they're starting to get those additional nutrients into their body.
Yeah, it's pretty amazing, isn't it? One of the more common things people don't realize is vitamin D levels. And we have both Mycel D3 and Myco D2. The Mycel D3 we have in the drops, 1,000 units per drop, and the D, 5,000 units per soft gel. And we have Myco D2, which is our oncomycin. Your immune system can't function without adequate D. Your body and your brain and your stem cells don't work without adequate vitamin D. You can't prevent calcification, metastatic calcification of organs without adequate vitamin D. It's a big deal, and a lot of people will miss it. You can actually do blood tests through LabCorp or Quest, and they'll tell you where you are. A lot of people say, oh, you're going to get toxicity of vitamin A or D. The number of people that get toxic is ridiculous. I mean, if you take our dosages, even the dosages I recommend, which I usually recommend taking 3 of 5,000 twice a day, which is like 30,000 units, people say, well, how much do you get when you're in the sun? I said, if you get 15 minutes of sun during the middle of the day, you're manufacturing 20,000 units in 20 minutes to half an hour. I mean, you're not going to get toxic. And the problem is vitamin D levels are really important, aren't they?
Very critical.
Thank you, Ryan. We had a good go today. Hopefully we will get some people that will be brave enough to call us in the next few days about the vaccine haranguing here in the state of California, the state of insanity. We'll be back in a moment. We're going to talk with John regarding Nutridyne. We have Pete Feddick, our upline super manager of Carrot Bar Gold, and that is an amazing business we're going to be discussing today. We'll be back in just a few moments.